Let me ask you something. What if the single most powerful thing you could do to protect yourself from cancer after the age of 60 had nothing to do with expensive medications, complicated treatments, or any of the things your doctor has probably already told you about? What if it was something so deceptively simple that most people overlook it completely? And what if the science behind it has been sitting in medical journals for years, quietly confirming what a small group of oncologists already knew? Stay with me, because in the next several minutes, I am going to walk you through something that genuinely changed the way I counsel my patients, and I believe it could change the way you think about your own health forever. My name is Dr. Favor Adeyemi. I have spent over 2 decades working with patients navigating cancer, from early prevention conversations to late-stage diagnoses I never wanted to deliver. I have sat across from thousands of people in that consulting room, and I have spent a significant part of my career asking myself the same question, over and over again. What could we have done differently? After 20 years, I have an answer. Not a complete answer. Cancer is complex, and no single habit prevents every case. But there is one daily behavior whose relationship with cancer risk is so thoroughly documented, so consistently replicated across so many different cancer types, that I believe every person over 60 deserves to understand it clearly. Most of you have never heard it explained this way, and by the end of this video, you will know not just what the habit is, but why it works at the cellular level, how much of it you need, and the specific mistake that undoes every benefit it provides. There is one thing I need you to promise me before we begin. Do not click away when I name the habit, because your first reaction will almost certainly be, "I already know that." And I am telling you now, you do not know what I am about to tell you about it. The research goes far deeper than most people realize. Stay with me. Before I name the habit, I need to explain the biological reality that makes it so important. Because without this foundation, the habit sounds like generic wellness advice. With it, it becomes something entirely different. Here is what is happening inside your body right now that most doctors never explain to their patients. Every single day, your body produces cells that contain genetic errors. This is not abnormal. This is biology. Your DNA replicates billions of times across your lifetime, and errors are inevitable. In a healthy body, 3 systems work together to catch and eliminate those errors before they become cancer. Your DNA repair enzymes identify and correct mutations. Your immune system, specifically a class of cells called natural killer cells and cytotoxic T lymphocytes, identifies and destroys cells that have become abnormal. And a process called apoptosis, programmed cell death, instructs damaged cells to self-destruct before they can replicate the damage. These 3 systems are your body's cancer defense architecture. They were built for exactly this purpose. Here is the problem. After 60, all 3 systems begin to slow down. DNA repair enzymes become less efficient. Natural killer cell activity declines. The apoptosis mechanism becomes less responsive. This is not a disease, it is aging. But it means that the cells with genetic errors that your body caught and eliminated at 40 are more likely to slip through the defense system at 65. The margin for error gets smaller. The daily maintenance of those 3 systems becomes more important than it has ever been. And here is where the habit comes in, because what researchers have discovered, in study after study, across cancer type after cancer type, is that one specific daily behavior directly enhances all 3 of those systems simultaneously. It upregulates DNA repair enzyme activity. It increases natural killer cell count and activity. And it promotes the apoptosis response in precancerous cells. One habit, 3 mechanisms. all three pointing in the same direction. Let me tell you about a patient I will call Victor. Victor was 67 years old, retired accountant, precise, methodical, the kind of man who tracked everything. He came to me after a routine colonoscopy found 3 precancerous polyps. Not cancer, precancer, cells that were moving in the wrong direction. Victor was frightened. His father had died of colorectal cancer. His brother had been treated for prostate cancer 5 years earlier. He sat across from me and asked the question I have heard hundreds of times. What do I do now? I told him about the habit. I explained the research. I gave him a specific protocol, and I asked him to commit to it for 6 months before his next colonoscopy. We will come back to Victor, because what his follow-up found is one of the most meaningful things I have seen in 20 years of this work. The habit is physical movement. Specifically, and this is the detail most people miss entirely, consistent, moderate-intensity physical activity. Not intense exercise, not marathon training, not gym memberships. Consistent, moderate movement performed most days of the week. I want to be precise about what the research actually says, because the popular understanding of exercise and cancer prevention is vague in a way that makes people either do too little or give up because they believe they need to do too much. Here is what the science shows. A landmark meta-analysis published in the Journal of the National Cancer Institute, examining data from over 1.4 million adults, found that higher levels of leisure time physical activity were associated with a significantly lower risk of 13 different cancer types. Not one cancer, 13, including colon cancer, breast cancer, endometrial cancer, kidney cancer, gastric cancer, bladder cancer, esophageal cancer, and others. The risk reduction ranged from 10% to over 40%, depending on the cancer type and activity level. These are not small numbers. A 40% risk reduction for a disease with the mortality profile of many of these cancers is clinically extraordinary. A separate analysis published in JAMA Internal Medicine found that adults who met the standard physical activity guidelines, 150 minutes of moderate intensity activity per week, had meaningfully lower cancer mortality rates than sedentary adults. 150 minutes per week. That is 21 minutes per day. That is a 20-minute walk. Let me say that one more time because I need it to land properly. 20 minutes of brisk walking every day is associated with meaningfully lower cancer mortality in adults over 60. Not chemotherapy, not supplements, not any intervention that costs money or requires a prescription. A 20-minute walk. Now let me show you the 3 mechanisms that explain why. Mechanism 1. Physical activity and DNA repair. When you engage in moderate physical activity, your body increases the production and activity of a class of enzymes responsible for repairing DNA damage. These include enzymes from the base excision repair and nucleotide excision repair pathways, the same pathways that catch the genetic errors produced by normal cell replication, by exposure to environmental carcinogens, and by oxidative stress. Research published in Cancer Epidemiology, Biomarkers, and Prevention found that physically active individuals showed significantly higher DNA repair capacity compared to sedentary individuals of the same age. The effect was particularly pronounced in older adults, the population whose repair capacity is most in need of support. Physical activity does not just maintain DNA repair function after 60, it actively restores some of the capacity that aging has eroded. The biological mechanism is partly mediated through a protein called PARP, poly-ADP ribose polymerase, which is one of the primary responders to DNA strand breaks. Physical activity has been shown to increase PARP activity. It also reduces the oxidative stress that produces the DNA damage in the first place by upregulating the body's endogenous antioxidant systems, superoxide dismutase, catalase, and glutathione peroxidase. Less damage entering the repair system. More capacity to repair the damage that does enter, both simultaneously. Mechanism 2. Natural killer cell activation. Natural killer cells, NK cells, are your immune system's frontline cancer surveillance force. Their function is specific. They patrol the body, identifying cells that display abnormal surface markers, the biological signature of precancerous and cancerous transformation, and destroying them before they can replicate. After 60, NK cell count and activity both decline. This is one of the primary reasons cancer incidence rises sharply with age, not just because more genetic errors are occurring, but because the immune surveillance system that would catch them is operating at reduced capacity. Physical activity is one of the most potent known stimulants of NK cell mobilization and activity. An acute bout of moderate exercise causes a rapid and significant increase in circulating NK cells. They mobilize from tissues into the bloodstream, where they can access sites of abnormal cell activity. Research published in the Journal of Applied Physiology showed that a single 30-minute moderate exercise session increased NK cell count by up to 50% in the hours following activity. But here is the more important finding for sustained cancer prevention. Regular physical activity, not just single sessions, leads to lasting improvements in NK cell function. Chronically active older adults show significantly higher NK cell cytotoxicity, the ability to actually kill abnormal cells, than sedentary adults of the same age. The surveillance system does not just temporarily improve after exercise, it permanently upgrades with consistent activity. This is the mechanism most oncologists point to when they discuss why physically active populations have lower cancer incidence. The immune system is doing more surveillance. More abnormal cells are being caught and eliminated before they develop into clinical disease. Mechanism 3. Inflammation and the cancer environment. This is the mechanism I consider the most important of the three, and the one least discussed outside of specialist circles. Chronic low-grade inflammation is now recognized as one of the most consistent features of the cancer microenvironment. Tumors do not develop in healthy tissue operating normally. They develop and thrive in tissue characterized by persistent, unresolved inflammation. Elevated interleukin-6, tumor necrosis factor alpha, C-reactive protein, and other inflammatory markers that create a biological environment permissive to abnormal cell growth. Here is what most people do not know. Sedentary behavior, not just the absence of exercise, but prolonged sitting and physical inactivity, is an independent driver of systemic inflammation. A sedentary body maintains chronically elevated baseline inflammatory markers. The tissue environment that results is precisely the environment in which cancer is most likely to develop and progress. Physical activity is the single most evidence-backed, non-pharmaceutical intervention for reducing chronic systemic inflammation. Regular moderate exercise reduces circulating levels of interleukin-6, CRP, and TNF-alpha. It increases anti-inflammatory cytokines, particularly interleukin-10. It reduces visceral adipose tissue, the abdominal fat that is itself a major source of inflammatory signaling, even in the absence of significant weight change. What this means practically is this. Every day that you move consistently and moderately, you are changing the internal chemical environment of your body. You are making it less hospitable to the conditions that allow cancer to develop. Not in a dramatic, visible way, silently, progressively, the same way that cancer itself develops, slowly, over years, through accumulated daily conditions. Movement is the daily condition working in the opposite direction. If you have made it this far, You are clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Now here is the specific mistake that eliminates most of the cancer preventive benefit of physical activity. And it is one that almost everyone makes: intensity. Most people who decide to start exercising for health reasons go too hard, too fast, too consistently. They begin high-intensity programs. They push into breathlessness at every session. And for cancer prevention specifically, this is the wrong approach. Not because high-intensity exercise is harmful, but because the immunological benefit curve for cancer prevention peaks at moderate intensity and actually begins to decline at very high intensities. Research examining the relationship between exercise intensity and immune function found that while moderate exercise robustly stimulates NK cell activity and anti-inflammatory pathways, very high-intensity exercise, the kind that leaves you unable to hold a conversation, produces a transient immunosuppressive effect in the hours following the session. The open window of temporarily reduced immune function after exhaustive exercise is well documented in exercise immunology. For cancer surveillance, you want your immune system consistently active and functional, not repeatedly suppressed and recovered. The optimal zone for cancer preventive benefit is moderate intensity, an effort level at which you can hold a conversation but are slightly breathless. A brisk walk, cycling at a comfortable pace, swimming, dancing, gardening at a sustained pace. Any activity that raises your heart rate to approximately 50 to 70% of its maximum and sustains it for 20 to 30 minutes. And consistency outweighs intensity every time. 5 20-minute moderate walks spread across the week provide more immunological and anti-inflammatory benefit for cancer prevention than 2 intense gym sessions. The frequency of activation matters more than the peak intensity of any single session. Quick question before we continue. How many days per week are you currently physically active for at least 20 minutes? Be honest. Write the number in the comments right now. The answers I see there consistently tell me where the biggest gap is between what people intend and what they actually do. Your number matters. And it might help someone else watching this who is exactly where you were 6 months ago. I promised I would come back to Victor. 6 months after that first conversation, Victor came back for his follow-up colonoscopy. He had committed fully to the protocol: 25 minutes of brisk walking, 5 days a week, without exception. He had not changed his diet significantly. He had not started any supplements. He had not made any other deliberate health changes, just the walking. His gastroenterologist found 1 polyp, down from 3. The remaining one had not progressed. His inflammatory markers, CRP and interleukin-6, had both dropped into the normal range from elevated baselines. His NK cell activity, which we had measured at baseline and again at 6 months, had increased by 34%. Victor sat across from me at that follow-up and said something I have quoted to patients many times since. He said, "I spent 6 months walking, and in those 6 months I felt better, slept better, and apparently my body started doing its job again. Why did no one tell me this 20 years ago?" I did not have a good answer then. I am trying to provide it now. The research that documents this effect has been accumulating for decades. The mechanisms are well understood. The dose is achievable by almost anyone over 60, and the cost is 0. Yet in most oncology consultations, including many of my own earlier in my career, this information either gets mentioned briefly as a footnote or not discussed at all. That gap is the reason I make videos like this one. Let me bring this together clearly and practically. The single daily habit with the most consistent, most replicated, most mechanistically understood cancer preventive effect in adults over 60 is consistent, moderate physical activity. Specifically, 20 to 30 minutes of moderate intensity movement, brisk walking, cycling, swimming, any sustained activity at a conversational pace, performed 5 or more days per week. The three mechanisms through which it works are DNA repair enzyme upregulation, natural killer cell activation, and sustained functional improvement, and reduction of the chronic systemic inflammation that creates the biological environment in which cancer develops and thrives. The critical mistake to avoid is either doing nothing because the amount required sounds too small to matter, or doing too much at too high an intensity and repeatedly suppressing the immune function the habit is designed to strengthen. Here is what I am asking you to do today. Not next month, not when the weather improves, today. Choose one 20-minute block in your day and commit it to movement. A walk around the block, a slow cycle, 15 minutes of movement followed by 5 of stretching. Something you can repeat tomorrow and the day after. The first day is the hardest, the second is easier. By the end of the first week, the habit is beginning to form. By the end of the first month, your NK cell activity is measurably higher than it was when you started. That is not motivation, that is biology. Which part of this changed how you think about cancer prevention? Tell me in the comments. I read every one. And if this gave you something you will genuinely use, share it. There is someone in your life who needs this information and does not have it yet. A parent, a spouse, a friend who is already navigating a cancer diagnosis and looking for every evidence-based tool available. That one share may be one of the most useful things you do for their health today. Subscribe for more honest conversations grounded in what the research actually says. Next time, I am going to cover the 5 foods that research increasingly connects to cancer risk in adults over 60, and at least 2 of them are foods most people currently believe are healthy. Take care of yourselves, move today, and understand this: the most powerful cancer-fighting tool you have access to is not in a pharmacy. It is in your body, waiting to be activated. You just have to give it the signal. Disclaimer: everything shared in this video is based on published oncology research, epidemiological studies, and exercise immunology literature. It is general educational information, not personal medical advice for your individual situation. Cancer risk is complex and involves many factors beyond the scope of any single video. If you have concerns about cancer risk, a personal or family history of cancer, or any existing health condition, please have a full conversation with your own physician before making changes to your activity level. They know your history. This information is a starting point for that conversation, not a replacement for it.